Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
This is a recording of Dr. Tom Roselle for Sunday, January 6th, 2013. You can listen to this program live every Sunday afternoon from 12 noon to 1 p.m. right here on 105.9 FM and AM 630. WMAL.
The following program is paid for by its sponsors, who are solely responsible for its content. Views expressed on this program are not the views of 105.9 FM and AM 630 WMAL. Real Estate Today, next at 1. Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio. It's beautiful outside, still a little nippy and chilly. Did you get the Christmas tree down? We got ours down actually this morning. It's all put away, and Christmas is gone for another year. But we're here to answer all your questions on natural health care from many points of view, from chiropractic, acupuncture, nutrition, and other things that you can think of that we haven't. But we'll answer the question. If you tried, you've applied, and you've come up with the same old, listen, we're here to try to give you a different perspective on any problem that you may have. 888-630-9625. That's 888-630-WMAL. Love to talk to you. We have a topic today, kind of an interesting topic, one that you wouldn't expect us necessarily to deal with, but we do because we have a lot of this in our practice. And what is this that I'm talking about? Well, it's called pregnancy and delivery, and in some situations I can't get pregnant, so we help along that way with different therapeutic regimes that work tremendously. But more importantly, we're going to talk about natural pregnancy. We're going to talk about the structural portions, the biochemical portions, the energetic portions. And in studio, one of my experts in this field, Dr. Stephanie Pina, who's not only an acupuncturist, but she's a doctor of naturopathy. And soon coming online will be Dr. Jennifer Sims, who is a specialist in our practice for women and children. So it's going to be a very lively conversation today, but we'd like to have your input. And I think that you're going to find this program at least saying, really? No kidding. You can do that? Dr. Pina, welcome. We'll get Dr. Jen hooked up in a minute or two.
Thanks for having me again.
It's always fun. And one of these days, I will give you the opportunity to be on this side of the microphone, and I will sit in your seat.
Yeah, I'm waiting for the day that I can ask you the questions and let you answer my questions.
Don't hold your breath. I mean, yes, we will do that. It's going to be a while. Nevertheless, we will talk about those things. So, it's wow, this must be a hot topic because like our lines are lighting up today faster than they have in a long time, but we're going to answer as many as we can. But more importantly, this Wednesday evening, you and Dr. Jennifer Sims will be our hosts at the Roselle Center for Healing, and you're going to be talking about natural pregnancies and some of this, things that can be handled through natural therapeutics, even some of the bad things that can be handled through natural therapeutics. It's an exciting topic, it really is, because so many women in this culture, in this society, they're at effect of the medical system, if you will.
Yeah, essentially, we get a lot of patients that come in, they may be just interested in getting the details right away, or they're maybe even, trying to discuss having a family. But once they get into it, they know that they want a different approach than what's available right now. And once they get pregnant, and, and this goes for both sides, both couples, when they kind of come into there, they don't know how much of those natural therapies that they were using in their health before they got pregnant to basically still use while they're pregnant, what's safe, what they continue using, what they need to modify, and then also going into labor and delivery, what can they do to make that the best experience they can, so they don't have to go in and be induced and they don't have to rely on the drugs. And it's nice perspective when you have practitioners who have gone through and used some of those same treatment methods, because they can give their feedback as well.
Well, from a personal point of view, I have obviously 2 children, 5 grandchildren, and I've been present for the majority of their births. But from the beginning of the pregnancy in the medical arena, it's treated as a pathology. It's treated as something gone wrong. And we have to test for this, we have to explore this, we have to do this, ultrasound every few months. And it makes me crazy because the damage that's done to the child potentially far, far supersedes any benefit that's going to come from this type of intervention. So let's talk a little bit about, and then we're going to get Dr. Jennifer online. Matter of fact, let's see if she's there. We can start talking a 3-way conversation. Dr. Jen, are you on?
I am.
Great. Welcome.
Good afternoon.
Good afternoon to you. So you've probably heard a little bit about what we've said. So what I want to talk about in the initial point of this conversation, and I know you and Dr. Pina are going to tag team this on Wednesday evening, is what really is and what should a woman be aware of, and a natural pregnancy or course of natural pregnancy. What is that all about?
Well, I mean, it's about a lot of things. It's about what you do even before you get pregnant, the diet that you have, the kind of care that you take with your body to get you ready. A lot of people, like Stephanie said, are having a hard time with fertility. And there's a lot of reasons for that. And a lot of it's what we're exposed to. Getting educated about birth, and it doesn't have to be so medically oriented, is another big deal. Most women are told that they have to have C-sections. They're planned, and there's a lot of things that go into it. It's not just getting pregnant.
Yeah, most C-sections in this country are for the convenience of the delivering physician, not necessarily for the efficacy of the patient or the patient-to-be, the child.
That's absolutely true. And there's especially with C-sections, there's this idea that if the baby doesn't come exactly at, 40 weeks, that there's something wrong and they need to get it out. Or they have all these different reasons to induce and force the body's natural process. So getting educated about things, trusting your body, learning about different birthing methods, all of those things go into the whole process.
Dr. Pina, what is critical in the course of a natural childbirth? A woman comes in, you treat them from a nutritional point of view with herbal preparations and with acupuncture and so forth. What do you look for, or what would you advise a woman in that she says, I want to do this naturally, I want to avoid drugs, I don't want this nonsense that's out there? How do you handle that woman?
Well, it's really interesting because you have women coming in at different stages of their pregnancy, and you have to take each one of those stages in its own hand and then really see what their goal is. The best thing they can do is put themselves in the best position going into pregnancy and also going into the childhood that they're going to be, the child they're going to be raising. But then they also want to make sure, like you were saying, that everything is set up for the child to be in the best position when they come into the world. I mean, pregnancy and having children should be about not only having that child having a live birth that's safe and healthy, and the child as well, but then also thinking about that child's future. Are they going to be able to have a natural pregnancy and be able to be fertile later on in life too as well? So it's definitely thinking about all the different influences. So there's a number of different things to kind of address each individual situation, but you want to make sure that they're in the right spot, that pregnancy and the delivery itself can be as smooth as transition as they possibly can.
Our topic today in studio is natural pregnancy. I have 2 experts with me, Dr. Stephanie Pina, Dr. Jennifer Sims, and they will be your presenter, your host, this Wednesday evening, January the 9th at 7:30 p.m. at the Roselle Center for Healing. If you'd like to attend, if you know somebody that is pregnant, if you know somebody that's anticipating being pregnant, if you know that you potentially have a problem, this is a presentation that you're going to get a lot of data on, and that you can really do some things differently. Give our office a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend. And as always, if you'd like to talk to either one of these doctors privately, you can call that number, leave them a message, or go to drtomroselle.com and send them a note, or you can go to Roselle Center or rosellecare.com. I'm getting confused with all these websites we're setting up. It's like, oh my God, really? Dr. Jennifer, you've been dealing with pregnancies and children your entire career. And so a woman comes in and, she has the predispositions of problems, meaning that her doctors told her that, you may be hypoglycemic, or they've done the blood sugar challenge, or her blood pressure is not what it should be, and so forth. How do you deal with those things from your perspective naturally without doing the ultrasounds, the immunocentesis, and all of those things? Can you deal with these things effectively?
Sure. So you're asking me if they're already pregnant and they have these issues?
They're already pregnant.
Yeah, I always laugh at the glucose tolerance test that is done, making women drink this synthetic sugary substance and watching to see if their blood sugar goes up. It's ridiculous. Most hypoglycemic issues can be managed with diet. Getting more protein, getting that patient to eat more consistently throughout the day. There's a lot of things that can be done naturally without getting on medication for low blood sugar issues. As far as ultrasounds go, they've gotten to the point where they're actually ridiculous. I was just reading an article about the 3D ultrasound parties that are being done, where women hire radiologists who do ultrasounds to come to their home and invite people to see the 3D image of their baby.
That's a sign of a really sick society when you figure if you've ever watched an ultrasound and you watch the baby on the monitor, the baby will do everything it can to get away from the ultrasound head because this noise is so intense that it does damage to that child. For our listeners to kind of correlate this, what the sound is and what the vibration is like is if you were laying about 5 feet away from a high-speed railroad track and the train was going by at full speed. That's right. A vibration that's impacted to the body. It's awful.
So I think that they do have their place in pregnancy to monitor, if there's something medically going on that's wrong, if there's bleeding, there's spotting, possible risk of abortion, spontaneous stillbirth. I think that they have their place. However, most medical practices have them do too many of them. Also, in my opinion, it is not clinically warranted to do an ultrasound to find out the sex of a baby, but it's become very routine and commonplace.
Yeah, so you can paint the room blue or pink, right?
Pardon me? Yes, and a lot of times they're wrong anyway. You paint the nursery the wrong color. So it's getting educated, knowing that there's not been a lot of research done on the safety of ultrasounds, and when you look into it, it pretty much says that. FDA does not have a lot of data on that. So why are we putting an unnecessary exposure in the womb that doesn't need to be there?
A lot of physicians will come back and tell you that the reason that they do the ultrasound is so they can do something to fix some type of problem that they're going to visualize. Well, the thing of it is that by the time the child is 4 or 5 months old, that's plenty of time to do one ultrasound if you feel that the child has a risk level, so you can do in vitro surgery, which they do today. But unless you're going to abort that child, there's no reason to do, in my opinion, to do that ultrasound early on. For what? To establish a baseline? To risk the child? To risk the mother? To disturb the placenta? I don't think so.
Right. And all that stuff, like your HCG levels, all that stuff is measured through the blood anyway. There's other ways to find out what's going on. I do think they're warranted in certain situations, but they've become excessive, and you don't need to do all that.
Well, sometimes mortgage payments have to be made. I didn't say that, right? Nevertheless, 888-630-9625. We have a lot of phone calls. We're going to get to them. I want to set the stage of what you're going to be listening to this Wednesday evening. You have two tremendous physicians here that know their stuff. They understand the neurology, the biochemistry, and also the energetics of what takes place during pregnancy. And also we're going to talk a little bit about the delivery process and what safe pregnancy really is all about. Dr. Pina, very quickly, kind of set the stage where we're going to talk about when a woman comes in and you examine her and she's pregnant, whatever stage of pregnancy it is, how can you make a determination whether or not that pregnancy is healthy at that moment in time?
Well, you really want to see what tests they have already done, because they're usually probably working with an OBGYN to begin with. But then from a natural standpoint, I want to kind of see what their vitality is like, what their previous pregnancies have been like, what their childhood was like, because it's going to tell me a lot going in how strong and stable they're going to be from an energetic standpoint, from their adrenal standpoint, also from a nutritional standpoint. What kind of things were they able to take in and put into their diet that they're willing to kind of change around too as well?
So you have to look at the entire thing. Dr. Jen, you're going to be looking at neurology as well. We're going to come up for a break in a couple of seconds here, and when we come back, we're going to take a couple phone calls, and please jump in, to help me with these. They're all across the board. But more importantly, as we go through the program today, I want to talk succinctly about not only what the risk levels are for some women, but what they can do proactively, naturally, to turn things around. Your hosts at the Roselle Center for Healing this Wednesday evening, Dr. Jennifer Sims, Dr. Stephanie Pina, on the 9th, 7:30 p.m. Call our office to reserve your seats. We'll be right back after these very important messages. Don't go away. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio with two very special guests, Dr. Stephanie Pina and Dr. Jennifer Sims. Our topic today is safe natural pregnancies and the things that you can do if you know that you're at risk and make things a whole lot easier. This Wednesday evening, Dr. Pina and Dr. Jennifer will be your hosts in the presentation in our office, January the 9th, 7:30 p.m. If you'd like to attend, 703-698-7117, 703-698-7117. Just tell my staff that you'd like to be there. These are our gift to you. We do these on an ongoing basis. All we require is a reservation. They don't cost you anything, but we'd hate to tell you that you can't attend because there's too many people. So please give us a call. We will confirm the reservation with you, 703-698-7117. Before we go on, ladies, we need to take some phone calls because otherwise we won't get to these. Anna, how can I help you? Thank you for calling.
Hi.
Hi.
Roselle, I have been having a ringing in my ears for about 15 to 20 years, and it's not a continuous ringing. It's a interrupted. It goes for about 2 minutes, and then it starts ringing again for about 10 seconds, and then it stops. And during this time, I get kind of dizzy and unsteady.
Well, let me ask you a question, Anna. Is it a high-pitched ringing or is it a low-pitched ringing?
It's almost like a static on the radio. It's not high and it's not really low.
So it's not a sound, it's more of like a crackling problem.
Yes.
Have you had your ears examined?
Yes, I have been to Johns Hopkins and University of Maryland and to my regular ENT person.
Have they told you what?
And they have told me that I either have a rocks in my ears or I have a vestibular
problem. The rocks in your ears that they're talking about are these crystals that form on something called the cochlea. And when you turn your head rapidly, do you get dizzy?
No.
Okay. Dr. Pina, from your point of view.
Well, it's kind of interesting. We get this a lot. In fact, we actually have another call on this too, but or similar. And from a Chinese medicine perspective, the kidneys, which has a lot to do with adrenal function, actually goes up and kind of generates a lot of the energetics of the ear as well. when you get a high-pitched ringing, that can be almost seen as like an excess of ringing, but a low pitch doesn't necessarily mean it's a deficiency. But it could be related to a lot of different things, any from trauma to essentially also just adrenal function as well to begin with. So a lot of the times, and especially people who end up having that sensation where they can actually hear a pulsating sound, that can be related to circulation issues as well. So there's a lot of things you can do, but essentially you've done the right things to begin with. Is you've got it ruled out what it's not to begin with, and then going from there.
Anna, it's one of those conditions that because you've had it for such a long period of time, there's some things that you can do that may make a difference. Niacin at a low dosage, particularly a time release, somewhere between 50 to 100 milligrams, working up to 500 milligrams, but time release. Niacin causes a lot of flushing. If there are these little rocks, as you describe them, they're crystals that form on the body of the cochlea, that can be due to either trauma or it can be due to infection. And either way, one of the most effective treatments is acupuncture and low-energy light laser. Sometimes that can make a difference. If it's the lower portion of the brainstem where the nerve roots come out that go to the ear, if there's pressure on that because of old injury, old trauma, then you have to deal with the irritation and compression at that level. Love to help you. Give us a call, and let's see what we can do. If you want some more information before that, just write us a note at rosellecare.com. Let's go to another one since we're on the topic. Diana, thank you for calling.
Hi.
Hi.
Mine is high-pitched ringing in my ears that I have developed over the past year. And I do have degenerative disc in my neck. I wasn't sure if maybe something was pinching on a nerve root causing it.
It's possible. You can have it from a couple different things. The high-pitched ringing, as Dr. Pina was starting to talk about, has to do with kidney energy. And it's a very common type of presentation. I'm sorry, liver energy, not kidney energy. Why didn't you throw something at me, Dr. Pina? I was wrong.
It could be both, we're both right.
It can be both, so we're both right. No, it's liver energy. But if it's a low pitch, then it's kidney, generally. But it can be a combination of those things. But a high-pitched sound is usually liver function. And it can be because of exposures to toxins. It can become because of exposures to different types of poisons, not eating the right things. The liver's not clearing, doesn't have enough glutathione in it, to metabolize toxicity. So it can come from different things. Going back to the fact that you have degeneration in the neck, can it? Yes, absolutely. Anything that will affect that inner ear mechanism and the membrane of the ear and so forth can cause sounds, but the distinguishing feature has to be based on what organ systems, what acupuncture energetics, and also nutritional deficiencies. If it's a high-pitched sound, in your particular case, what may work is a time-release niacin, but if that's it, that tells you it's a liver function problem, and then you have to go to the extent of clearing that out.
Okay.
So if we can be helpful, please give us a call. You're not too far away from us. Dr. Pina will be more than happy to walk you through it. And as always, get a hold of us offline at any time, and we'll be happy to get back to you. We're coming up for a break and the news and some very important information. My guests in studio, Dr. Stephanie Pina, Dr. Jennifer Sims. We're talking about natural pregnancies. These ladies will give you a whole lot of data as the program goes on. Don't go away. We'll be right back after the news. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you. My guest in studio, Dr. Stephanie Pina and Dr. Jennifer Sims. We're talking about natural pregnancy and the course and events that should be instead of the ones that you're recommended to do. Dr. Jennifer, you still with me?
I am.
Excellent. So let's talk about what happens when a patient is told that she's going to have to have a C-section because she's breech, or because the baby's not just positioned properly, or whatever. I know you do some very, very special things. They're extremely effective, and I know Dr. Pina does as well. So let's talk about that for a little bit.
Well, breech presentation, usually the baby can move around in there, right? It does move around. A breech presentation is basically when the baby's not in the right position. There's several ways that can happen, and there's a lot that you can do structurally with that patient's spine to widen the pelvis or have the pelvic muscles relax in order for the baby to get in the right position. Specifically, a maneuver done by a chiropractor is called the Webster technique, and pretty much it's an adjustment that it reduces the interference of the nervous system, and it helps balance the pelvis, essentially, and the ligaments and the round ligaments and all the ligaments that support the pelvis. I have a lot of patients coming in pretty much at week 36 and on being told that their babies are in a breech position, and will seek out this type of chiropractic adjustment to help their pelvis relax so that the baby can move back. In addition, I also work a lot with Dr. Pina on this, with her moxibustion, which, Stephanie, you want to talk about what you do?
Sure. Yeah, it's kind of funny. We get them coming at the same time.
I know. I'm like, Stephanie, we got another one.
You always know when there's two new patient interviews back to back that's pretty much what it's going to be. And it's Dr. Jen and I. Moxibustion over the point is called UB67, which is actually at the very edge of the tip on the small toe, has been shown as a point that the urinary bladder channel actually goes from that top of the head down to the toe, so it's going basically along the entire spinal process. So it fits in well with what Dr. Jen's saying, because it definitely has a nervous system component to it. Moxa in itself is an herb called Artemisia that burns very warm. And with this particular process, what it does is when you burn this herb over the area, you're not exactly putting it on the skin because it would burn the skin, but you're having the patient either in the office or at home do a therapy where they're holding this heat source over this particular point. And what it actually does is it actually stimulates oxytocin levels, and also it works into the adrenocorticoid level in the brain to actually help improve fetal movement and activity, and also help to move the baby itself. The baby actually gets more active. So patients will come in and they'll do this, and they'll actually be able to feel the baby kind of moving around, readjusting and shift themselves. And there's been a lot of studies done that anywhere between 60 to 90% of the babies actually will turn into a regular position basically within about a 10-day period. So between doing the manipulation and doing moxa, which can be done, at home and in the office, the babies can turn, then they're going in and getting checked by their, midwives or OBGYNs, and essentially they're able to see some great success, and it's a little, there's no needling actually involved with that whatsoever.
No.
So
the combination of what the two of you do when it comes to turning a child or putting them in position so that you can enhance the effectiveness of delivery is superb. It's amazing, because you said 60 to 90%, but when you add the manipulative modes with the Webster technique, it dramatically increases. I've seen very, very few patients that have failed to turn, and it's really outstanding. It's amazing.
And the ones that don't, the body's smart and the baby's smart. If there's something wrong, the cord's wrapped around the neck, intuitively that baby knows it's where it needs to be. And that's what I always tell, moms that come in. We're going to do this, this, and this, but if it doesn't work, it's okay. Most times it does, and I find in my experience, the patients that it works with, within 48 hours, I get the phone call that baby moved.
Here's an interesting story, one that we all know about. When my daughter delivered her second child, the baby, she went full term. She was about a week over, and she wouldn't deliver, and I did acupuncture on her, and I think, Dr. Pina, you did as well, or at least Connie did, and we did it almost every day to get that baby to move. And generally, one acupuncture application, when a mother's ready to deliver, is enough. Boom, the baby's born. She would not deliver. She would not go into labor. And as it turned out, we were very fortunate, because going back to what you said, the body knows what it should do and what it shouldn't do. So even the application of that is not, the contraindication is not there. Erin couldn't deliver. Her uterus was paper thin. Had she delivered, had she gone into full contraction, she would have hemorrhaged. And so the body, in its innate capacity to know what it should and should do, is amazing. The things that we're talking about and the side effects of what you do are virtually non-existent. They don't have a major impact on the body negatively.
No, not at all. In fact, it's very safe. And like I said, it's not an external procedure. It's not an internal procedure when you're thinking of baby turning. I need to be clear about that, because there's a lot of gray area with how we explain this. But what it is really just allowing that spine, the pelvis, the muscles supporting the pelvis, the ligaments to relax, so that when the mom goes into labor, that the baby has the room and the position and the ease to do what it needs to do.
The interesting thing is that if you go back and you look at old folk remedies, these are things that have been done for decades. Heck, hundreds and hundreds of years. And, they've been used not only on women but also on animals. And the effectiveness is amazing, and it keeps blowing my mind every time that I watch the application of these things. Women will come into the office, and the doctor says, well, you're going to have to do this or that, and you guys take care of them, and it turns it completely around. This Wednesday evening, these two phenomenal physicians are going to be talking to you about natural pregnancies, the things that happen to occur, the things that you can do and avoid any kind of surgical intervention, the things that you can do to avoid medications, the things that you can do to make sure you maximize your health and wellness during the pregnancy, but also, more importantly, your child's. Love to have you as our guest, 703-698-7117. That's 703-698-7117. This Wednesday, January the 9th, 7:30 p.m. All we need is a reservation. Give us a call. I want to go to the phones because we have still a lot of people holding. Jake, how can I help you? Thank you for calling, and thank you for waiting and being patient. Jake, are you there?
Yes, hello, Tom. How are you?
I'm doing well. How can I help you, sir?
I've got two things I'd like to talk to you about, Tom. I have esophagitis with an ulcer in the throat, and I also have a herniated disc.
Where's the disc?
Near the bottom of the back.
Okay. How long has it been there, and do you have any pain extending into the legs, either into the feet, to the legs, the buttocks, any place like that?
It's been there for a little less than a year, and yes, I do have pain going down my right leg into the calf muscle.
Is the pain constant?
No, it's all right when I sit down, but when I'm relaxed, it's okay. But if I walk any distance, it really starts to bother me.
How was the disc diagnosed?
Degenerative disc.
So degenerative disc, but did they do an MRI study?
No, they did an X-ray.
Okay, so the thing that is, you don't know whether or not the disc is herniated because only an MRI will show that. And so you've got degenerative disc, but that's not the same thing. It may or may not be causing the leg pain. It may or may not be causing the back pain. Is the pain worse when you go from does it flare up when you go from a sitting to a standing position? You walk around a little bit, it gets a little bit better, but the further you walk, the worse it gets?
It's all right when I sit up, stand up, but like I say, walking any distance, say a block, aggravates it.
Okay. How about if you're in the bathroom and you're having a bowel movement? Does that pressure cause pain, or is it not involved at all?
I didn't quite hear you, Tom.
If you have a bowel movement, if you're in the bathroom and
yeah. No, I've been cautious. I don't bear down hurt. No.
Okay, so the chances are you don't have a herniated disc.
All right.
Okay, the chances are that you have other structures that are involved. You can have facet, these are the gliding points of the vertebrae that can be irritated, and they could be what we call hypertrophic and large, so they're causing a localized irritation, but the extension pain, the pain into the calf, is part of the nerve root called the sciatic nerve. It also can be because the pelvis can be misaligned. It can be because, and that can happen for a lot of reasons, from trauma, but nutritionally, if it is your habit, and I'm just going to give you a list of things, if it's your habit to drink coffee, sugars, alcohol, fast foods, fried foods, things along that nature, over a period of time, and you add that to stress, the one structure that will break down first is your low back because of the different ligament and tendinous structures that have to do with the adrenal fight-flight system. That system puts out steroids, and if you're eating those things and under a lot of stress, what happens is it breaks the body down, and then ultimately you become susceptible. The bottom line is, based on what you're telling me, you can be helped. It's not something that you have to live with. It's something that can be dealt with. A full examination would show what it really is. All the X-rays are showing you at this point is that you have degenerative disease that can be there. And I promise you, it's been there more than a year. If you have degenerative disc problems, it's been there for at least a decade to 15 years. And you have to put all the pieces together. Jake, if I can help you, give me a call. I appreciate it. We got to get on to our topic and what we're dealing with. Dr. Pina, Dr. Jen, let's talk a little bit more about natural pregnancies and how we can take patients and maximize their care. Dr. Jen, you first.
Well, we can educate them, like I said in the beginning, about how to take care of themselves nutritionally, dietarily wise, getting adjusted during your pregnancy is a better choice than coming in at week 36 and telling me that you heard about us because you're breech. Because statistically, if you get chiropractic care during your pregnancy, that isn't the normal situation. Normally, it actually helps prevent those type of presentations. So educating people about the importance of using a chiropractor just like they use an OBGYN for their prenatal care, incorporating that in is really important, not to mention after the baby comes, getting the babies treated as well.
Interesting article that was published in the Journal of Manipulative and Physiological Therapeutics, actually about 2 years ago, maybe 3. My brain, forgets about time. And it was a very, very large study about women who were treated chiropractically on a regular basis over time, and particularly during their pregnancy. If they were treated every other week throughout their entire pregnancy, they in fact had much easier, much shorter deliveries than women who did not. And it was a very, very heartwarming publication for me, simply because 36 years of practice, that's what we've been doing. We've observed that clinically, but here's a study that bore that out. This Wednesday evening, January 9th, Dr. Stephanie Pina, Dr. Jennifer Sims will be your host, and they're going to be talking about natural pregnancies, delivery problems, and some of the unfortunate side effects, things like preeclamptic situations and the problems that women get themselves out to, but how you can deal with that without getting into the drugs, without getting into profound interventions that nobody wants to have. Dr. Pina, same question for you.
Well, it's interesting when patients come in for acupuncture and to see me, they usually think, I usually get them about a week before they're going to get induced for labor, and so they're saying, okay, I'd like to do this naturally, can we do this now? Same thing goes with the acupuncture. You can do that throughout the whole pregnancy. In fact, you're using that to help out with fertility as well before you get pregnant. And even after, when you have blood loss through pregnancy in Chinese medicine, that's a blood deficiency. You want to build that up so you can actually, the mother will be healthier after, the baby will be healthier. And it's also been shown to help prevent certain cases of postpartum depression as well, too. So acupuncture can be used throughout the whole pregnancy. There are a few acupuncturists who actually do it, but you have to avoid certain points, but it can be done the whole time as well.
We're coming up for a break. We'll be right back. And I have a question that I want to ask both of you, because there's an old folklore that says that with every child, a woman loses a tooth. I want to ask you what that's all about. Don't go away. This is Dr. Tom Roselle.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live, reminding all women to conduct monthly and annual breast exams. Also consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram, and it's safe and non-invasive. For more information, call 888-485-7736 or visit thermographycenters.com. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We are in studio, broadcasting to you every Sunday at 12 o'clock from WMAL on your dials at 105.9 and AM 630. We're here all the time. Try to make it as interesting as we possibly can, change the topics. I tried to never make these a canned program simply because I want to give you the opportunity. We've had so many phone calls today, and unfortunately I'm still leaving a ton of people online. If you need to talk to me, if you'd like to talk to me off the air, if you'd like to talk to Dr. Pina or Dr. Jen, all you have to do is go to drtomroselle.com and send a note. Or you can go to rosellecare.com and send a note. Or you can call us at 703-698-7117 and leave a message and tell one of our doctors that you'd like to speak to them. More importantly, all these programs are keyed up for your re-listening pleasure. You can go to drtomroselle.com, and they're all archived. WMAL keeps like 4 of them, so you can go into their website and check them out as well. We try to do the best we can. Last week's program on goal setting is there for you, so those of you who want to re-listen to that, go to drtomroselle.com and download it. It's there. It's our gift to you. Dr. Pina, Dr. Jen, This Wednesday evening, obviously, you are going to present a fascinating topic that is going to affect many, many women. What I'd like to ask you is simply this. Tell us a little bit about it. What's the interplay? How are the two of you going to tag team off each other? Dr. Jen, you first.
Well, I'm going to talk about the perspective of the chiropractic adjustment, manipulation, the spine, the nervous system. Also touch on the birthing process itself, how babies come out, and what we can do once they come out as well. So touch on a lot of different things from before birth, during the pregnancy, after the pregnancy, but all from more of a structural setting.
Dr. Pina.
I'm going to be looking at it from more of the Chinese medicine setting, and so more energetically what's going on. Why is it that certain conditions, why is it that people's allergies and sinus conditions get worse with pregnancy? Why is it that they have issues with blood flow before and after? And basically also kind of discussing, too, some of the older traditional methods that they've used to help prepare mother and child before and after birth, as well as herbs as well, too.
Fascinating topic. It's one, really, that if more women knew that they had options, if they had alternatives that they could grab a hold of, we wouldn't treat birth and delivery process as a pathology in this country, which is something that we do. It's unfortunate. We have better outcomes in other parts of the world that don't have the sophistication that we have. And I know that the two of you are going to handle that, and you're going to go back and forth. And I truly encourage anyone who is listening that is pregnant, that is going to be pregnant, that thinks that they may have a problem, who's afraid of the delivery process. This is a topic, this is a night that you really can learn from. Give us a call at 703-698-7117. Ladies, I appreciate your input, and I'm looking forward to Wednesday night's topic as well. Dr. Jen, we will see you later. Dr. Pina, thank you very much.
Thank you.
Coming up to the end of the program, and it's unfortunate, it's way too short. We still have people online. Please get a hold of us at drtomroselle.com, and we will get back to you and answer your questions. It's just one of those, unfortunate situations. We'll see you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.